So you have to do it by own, right? Okay. So advanced care directive. So you can just Google it, Advanced Healthcare Directive, Australia. Then you can find different guidelines here. For SA here, then you can find Victoria guidelines. Like they are like almost same, the general idea. Okay. Yeah, doctor. Actually, I can't do 70 questions now today. Okay. So yeah. If someone has like selected these are from mandatory notification, and if someone can do that, then I can do questions. Otherwise, I don't have time for that. Yeah. Okay. So let's discuss about advanced healthcare directive. So what is it, doctors? Advanced healthcare directive. So what is it? So what is it?
May I ask something, Doctor?
Yeah, doctor. Sure.
Doctor, can we do that the hierarchy thinks that the patient is not compatible with the
Yeah,
mm,
doctor. To go that
consultant?
far, to discuss hierarchy, first of all, you should know what is Advanced Healthcare Directive, right? So, first of all, we should
Okay, okay.
discuss
Thank you, Doctor.
what is Advanced Healthcare Directive. Mm-hmm. Yes, yeah. It's Advanced Healthcare Directive. We can define this Advanced Healthcare Directive as different ways, right? We can call it as a living will as well. Okay. Here, Advanced Healthcare Directive is a legal document in which a competent adult record their future healthcare preference to be followed if they lose decision making capacity, right? It guides doctors on what treatment can or cannot be given. Okay, I made this note from two different guidelines. Okay, because if you can search in the Google Advanced Healthcare Directive, there are different guidelines. I went through a few of them and I made my note. Then, so what is the purpose? Respect patients' autonomy, guide clinician when the patient cannot consent, reduce family conflict, provide the legal protection to clinician when followed in good faith. So before that, who can tell me what is the autonomy of patient? What is the autonomy? What is autonomy, doctors?
Doctor, it's a decision
Fundamental
of the
ethics.
patients.
Mm-hmm. Okay, so oh, sorry, it is happening. Minute. Okay, so you should know what are the different words, right? So autonomy we will discuss when we get questions. Autonomy means respecting a patient's right to make their own informed decision, provided they have decision making capacity, right? So autonomy means patients' right to make their own decision, right? But in that case, patient should have the decision making capacity, right? Yeah. Okay. What is in the chat? Yes. What doctor? What should we select in e-medicine to do? Doctor, you can search ethics. Then you have I think bioethics 70 some questions. Then you can do. They can cover so much areas. Okay. Yeah. And then here this is this guideline from this is essay health guideline. Okay. Mm. So the same thing, and you should know who can write an advanced care directive. Any adult can write Advanced Care Directive whether you are young, older, or healthy or sick. To write Advanced Care Directive, it must be your choice, and you must be age 18 years and older, have decision making capacity, known what an advanced care directive is, and know what is will be used for and when it will be used, right? So when will it be used? The advanced care directive can only be used if you do not have capacity to make particular decisions. For example, you may still be able to make some decisions but not able to make others. This may temporarily or permanently. Yeah. Then sharing of your advanced care directive. It is important that you let people know, like especially family members, that you have advanced care directive and where to find it. Especially it is an emergency. And you should make a multiple certified copies. You to certified copy to your chosen substitute decision makers and give certified. I will discuss about substitute decisions make as well. Okay, don't worry. Give the certified copies to people who care about you and care for you, especially family and your relatives, right? And your friends and your doctors, like that. And you should upload a copy to your My Health record. Okay, please remember this. And can the patient change the exciting advanced care detective? Yes, patient can update current advanced care directive by completing a new advanced care directive form. Okay, a currently advanced care directive form will continue to be valid unless you complete a new advanced care directive form. Once you have completed a new advanced care directive form, make sure the old one is destroyed, including any of certified copies. Right? And remove all from the electronic platform like My Health Record. Yeah. Yeah, the same thing. Yeah, the same thing, doctors. Yeah. Okay, the next thing, who is a substitute decision maker? Substitute decisions maker. Who is that? Who is that, doctors?
A person
Substitute.
who is
What, doctor?
nothing.
Okay. So, substitute decision must maker should be the one of person that you trust and who is over 18 years old and who will listen to your values and preferences for future care and who will be comfortable making decisions in difficult situations like emergencies, right? Yeah. Okay. Then, when you decide in when you want to make a substitute decisions maker, first of you have to ask yourself, am I confident this person will make a decision based on what I would want, right? And here you can choose two persons for the decisions. Sorry, who substitute decisions maker here. You can also choose second person as an alternative decision maker. They will step up if your first decision maker is unable to make decisions on your behalf, right? Yeah. The same thing, the same thing we just discussed. Yeah. So now you know about advanced care detective and who is substitute decision maker, right? You can have substitute decision maker and you have alternative, the second substitute decision maker as well. So let's discuss about the hierarchy of decision making.
And doctor?
Yeah,
A
doctor.
patient can have two things. One, advanced care directive, and second one is substitute decision maker. Means advanced care directive cannot do the decisions of patient's life.
What, doctor? I didn't get the question. Can you repeat it?
Yes, doctor, I am saying that advanced care directive cannot make the decision of patient. It can be done by only substitute decision maker.
Yeah, we will discuss now, doctor. Now we are discussing hierarchy, okay? Wait, then you will understand it, okay? So, okay, so the next one is, so first we just know what is advanced healthcare directive, and we know who is substitute decision maker. So then the next thing is when we should apply these things. When? Why the patient should have advanced care directive? So why? When? This apply when a patient lacks decision making capacity for the specific decision. Okay, when we should use this hierarchy, when patient is having lack decision making capacity. So this is the hierarchy you should know. Okay, this is, I can't remember the guideline, as I remember it's a Victoria guide, and you can just Google it and then you can find it. Okay, so don't worry. So, what is the hierarchy of treatment decision makers? The hierarchy of treatment decision makers is only used when health professionals, when you lose capacity. So, first thing first, the top one, the first number one hierarchy is advanced health directive. Advanced health directive. So, please remember this is the number one, if you have a substitute decision maker, anyone, but this is the first thing we should consider in the if there is an emergency situation, right? So we know what is advanced health directive. Decision must be made in accordance with the advanced health directive unless circumstances have changed or could not have been foreseen by the maker. Okay, so if advanced care directive is not available or this advanced care directive does not apply for that emergency situation, or in that case we have to move down to the um, second step of the hierarchy. Okay, here, enduring guardian with authority. So who is that guardian with authority? So, guardian with authority means substitute decision maker, right? And here you should know step one, valid advanced care directive. This take highest priority and override family wishes and substitute decisions maker. So, second one, okay, then appointed to the substitute decision maker. This is step two, because in if the advanced care directive is not available or it does not apply for the that current emergency scenario, in that case substitute decision maker, we should give priority to substitute decision maker, and you should know few more criteria about this substitute decision maker. Substitute decision maker cannot change the advanced care directive. A valid advanced care directive override the substitute decision maker. So please remember, what is the substitute decision maker? Can do make decisions only when the patient lack capacity, make decisions only with the limits of ACD. ACD mean advanced care directive, decides on issues not covered in the ACD or using the patient's values and wishes. So this is the common criteria. It should be here. Okay, the commonly identify, what is this? Here the same thing. And I'll give an example, okay? Auntie 59 had a few things wrong with her health, diabetes and heart problem. She came from a big mob, lived in a small community, and she worried that there, there might be a family argument and worry if she got really sick. Her family couldn't sort out what was right for her if she did get very sick. So Auntie decided to appoint her daughter Josie in her advanced care directive to make decision for her if she couldn't make decisions herself. Auntie talked to her daughter about the what she wants, and she also made sure her family and community knew her wishes. Doing this on a legal form gave her peace of mind because she knew her wishes would be clear and could be acted upon, and she could continue to be respected as an elder. So uh, the same thing, doctors. We just discussed more than 80 knows well and someone you trust, the same thing. And you cannot appoint someone who is paid or care for you. Please remember this point, okay? Like your doctor, nurse, or professional paid carer. You can't appoint those as your substitute decision maker. Then family member or friend who are paid carer allowance by Centrelink can be appointed as a substitute decision maker, family member, friend like that you are trusting. Your substitute decision maker must agree to be appointed. Talk to the person or people you want to be a substitute decision maker. Tell them what type of decision you want them to make for you and how you want them to make a decision for you. Yeah. So that's for this is enduring guardian with authority. So next one, guardian with authority. Then the next one. Next one is who? Next one is the family member. If there is no if no one formally appointed as a substitute decision maker and default decision maker is used according to the state of hierarchy, usually this follow order of spouse. Okay, if the like as example, if wife is in a lack of consciousness and they need to decide about the treatment and there's no advanced care detective or no appointed substitute decision maker, then the next hierarchy goes to his partner, right, the husband. If there's no husband, then hierarchy goes to a adult child, okay, like that. Then parents, then siblings, then other close relative of friends. Okay, others. Yeah. Then what else? Yeah. Parents, sibling, primary unpaid caregiver. Yeah, that is the hierarchy that you should know. Hope you all understand about the advanced care directive and hierarchy. Do you have any questions related to this, doctors? Wait 1 minute. Oh no, not this one. No, not this one. I have added one question for not this part, doctors, from my notes. So I'm going to stop this. Then we can move to the next topic.